Hello, my name is Jacqueline Jankow, and for this presentation I will be talking about Gene Watson's theory of human caring and the use of this theory for communication with cancer patients. The theory of human caring was developed by Gene Watson with a strong background in educational counseling and psychology in 1979, while designing an integrated baccalaureate curriculum in a large nursing school. The goal of this theory was to present nursing as a distinct entity, a profession, a discipline and science in its own right, separate from but complementary to medicine. This theory was formally articulated in 1985 in her book, Nursing, Human Science and Human Care, which elaborated on the caring occasion, the transpersonal nature of caring, the 10 curative factors which later evolved to the critical curitas processes, phenomenal fields, the influence of time, and human growth. The theory of human caring means that all persons are considered to be unique and have a life history. This includes social norms and experiences that generates a subjective reality or phenomenal field. In this is included a caring occasion, which means whenever a nurse and another person come together with their unique subjective realities, they seek to connect to each other in the present situation. Through such relationships, humans grow, learn, and develop. Thus, both the carer and the one being cared for benefit from the encounter. When communicating with a newly diagnosed cancer patient, this theory is useful to apply. This theory demonstrates why nurses become nurses and not doctors. It is because of the caring aspect of nursing and the relationship that is built between patients and nurses. Nurse practitioners work with others and their patients through caring moments. This involves an action and choice for the two to come together and decide what to do with the situation and the moment. It is through a combination of caring moments that the nurse may accomplish healing at its most holistic form. The patient and family work together to decide the plan of care and feel confident that wishes and plans are followed. Patients feel comfortable asking questions and talking with the nurse about cancer and what to expect. There is support between both the patient and the nurse. We can use the clinical curitas processes to communicate with our newly diagnosed patient by following these 10 things. We can first embrace altruistic values and practice loving kindness with the patient. We can instill faith and hope with our cancer patients and our families. We can stay sensitive by nurturing the patient's beliefs and practices. We can develop a helping, trusting, caring relationship. We can promote and accept positive and negative feelings by listening to the patient. We can also use our creative scientific problem-solving methods for caring decision-making. We must also share teaching and learning that addresses the patient needs and comprehension styles. We must create a healthy, healing environment for the physical and spiritual self that respects human dignity. We must also assist the patient with basic physical, emotional, and spiritual needs. And lastly, we must stay open to the mystery and allowing miracles to enter. Thank you for watching my presentation about Gene Watson's theory of human caring and the use of this theory for communication with cancer patients.